What is the new XEC Covid variant? The coronavirus is known for its ability to constantly mutate. The new mutant we are talking about is believed to be more capable of spreading and may cause different symptoms than previous mutant. What distinguishes it most is its clear effect on muscles and bones in addition to respiratory symptoms. It is important to know that each mutant has distinct characteristics based on the genetic changes that have occurred in it. Common symptoms of the new corona mutant. Respiratory symptoms: fever, cough, shortness of breath. Symptoms of the musculoskeletal system, which have become more common compared to previous mutant, include muscle and joint pain. Patients feel severe and unexplained muscle pain. Large joints such as shoulders and knees are more affected. Chronic fatigue. General fatigue, even after weeks of recovery, is considered one of the most prominent long-term symptoms. Muscle weakness. Some patients have difficulty regaining their physical strength. Effects on bone health. Medical reports indicate that the virus affects calcium and vitamin D metabolism, which increases the risk of osteoporosis in some patients. Lack of movement during illness or isolation negatively affects bone density. How does the new corona mutant affect bones and muscles? Muscle inflammation. The virus causes systemic inflammation that affects muscle tissue, leading to persistent pain and difficulty moving. Muscle inflammation may result from an excessive immune response or a direct effect of the virus. Lack of body activity. Patients are forced to move less during the infection or recovery period, which negatively affects muscles and bones. Excessive rest leads to muscle atrophy and weakness, especially in the elderly or those with chronic diseases. Blood circulation problems. In some cases, the mutant causes problems in the blood vessels, leading to poor blood flow to the muscles and bones, which causes long-term complications. Vitamin D deficiency. Due to the lack of sun exposure during isolation, patients suffer from vitamin D deficiency, which increases the risk of weak bones. Who is most vulnerable to the effects of the variant on bones and muscles? The elderly. Patients with osteoporosis or arthritis. Patients with chronic diseases such as diabetes or kidney disease. People with a sedentary lifestyle. How to prevent and reduce the impact on bones and muscles. 1. Prevent infection. Vaccination. Make sure to get the full doses and booster doses if available. Maintain a safe distance from others, especially in closed spaces. Wearing a mask. Be sure to wear a mask in crowded or poorly ventilated places. Personal hygiene. Wash your hands regularly with soap and water for at least 20 seconds. 2. Maintaining bone and muscle health during illness or isolation. Diet. Eat foods rich in calcium, such as milk and its derivatives. Take vitamin D from natural sources, such as eggs and fish, or nutritional supplements after consulting a doctor. Physical activity. Even during isolation, try to do light exercises to move your muscles and stimulate blood circulation. You can do stretching exercises or slow walking indoors. Drink fluids. Good hydration helps reduce muscle inflammation. 3. Post-recovery healthcare. If muscle or joint pain persists, visit a specialist. You may need to have blood tests to check your calcium and vitamin D levels. Physiotherapy programs may be necessary for some patients with muscle weakness or chronic pain.